Max, the UIL State Championship games at AT&T Stadium in Arlington, just around the corner. And Baylor, Scott, and White Health will be on site at the Fan Fest to help celebrate with football faithful from all over the state. We know they're going to be streaming in from all corners of the Lone Star State. And what a better time to talk to Dr. Sheena Black, an orthopedic surgeon specializing in orthopedic sports medicine and arthroscopic procedures on the medical staff at Baylor, Scott, and White Medical Center in McKinney. Dr. Black, thanks for joining us.
No problem at all. Good afternoon.
Tell me a little bit about how long you've been with Baylor, Scott, or in the Baylor, Scott, and White system, and why is that? Why do you think that's the right place for you?
So I actually started with Baylor, Scott, and White in September of this year. Mm-hmm. I just finished my fellowship in sports medicine and shoulder surgery last year in New York City. And I knew that I'm from Dallas, so I knew Baylor was a trusted name in healthcare. And as the DFW market is continuing to grow, Baylor's making themselves available in all of our, all the new markets that are in DFW. So I knew that, with increased sports participation in our young populations, that families kind of look to the hospital system that they know and trust to take care of their kids and themselves. So that was kind of how I, ended up here at Baylor.
So the word we've heard a lot with you is sports medicine. You studied that and that's your specialty. So what kind of specialized procedures does Baylor Scott and White Medical Center in McKinney offer to athletes of all ages?
So I actually treat, I'll take care of the youngest, 10-year-old athletes all the way up to our weekend warriors, and even the aging athletes are some of my more common patients. I specialize in knee, shoulder, and hip arthroscopy, which means I use minimally invasive techniques using a small camera to treat common sports injuries. With the small cameras, it means that patients can recover faster and they have less pain. I don't like to say that they can get back to sports faster, because I think that is a common misnomer with athletes, especially, in the NFL, people are trying to get back as quick as they can. But less pain, and I think as long as they do their recovery right, we can get them back to playing their sports. Even with my older athletes with arthritis and wear and tear of their joints, we can get them back to their normal exercise activities through joint replacement surgeries, knee replacements, shoulder replacements, other things like that.
I know that Baylor Scott and White Medical Center in McKinney has a number of relationships with local high schools in the area. Based on what you see as a physician, as a medical professional, what's the best advice you can give to maybe high school athletes and maybe especially football players as far as taking care of their bodies is concerned?
So I would say, as far as football players go, I would just encourage them to take care of their bodies. I think injury prevention is really the name of the game. So during the in-season, I would say address any injuries as they occur, take them seriously, allow adequate recovery time to allow your body to recover, stay hydrated, and then really eat nutritious food and get plenty of sleep. You're still a growing kid during this time. And then as far as the off-season, I like to use this for extended recovery time. And then also there's a lot of really great injury prevention programs and training programs throughout the DFW Metroplex that I would encourage these kids to get involved in, just so they can try to stay out of, my office, essentially.
Yeah, you don't want to see them, is what you're saying.
Well, no, I'm happy to see them. But, of course, as a parent myself, I never want to see my kid get hurt. So
we're talking with Dr. Sheena Black, orthopedic surgeon specializing in orthopedic, sports medicine, and arthroscopic procedures on the medical staff at Baylor Scott and White Medical Center in McKinney. Here on Texas Football Today. Get involved in the conversation, #TF Today. All right, Doc, in your career, what are maybe some of the changes you've seen, especially in football players, maybe how the sport is changing or perhaps how the medical profession has adapted to those changes?
So I think really right now concussion is kind of the hottest topic, especially in football. I think as a physician, I'm now more in tune to recognizing signs and symptoms of concussion. And when I'm covering a game, if I am at all concerned that an athlete has had a concussion, they are not going back in the game. A lot of times we even take their helmet away just because they're not going back in. I even have a neuropsychologist that I work with who specializes in concussion treatment. So I have all of my athletes see that person the week after the injury, just because we're really, kind of seeing the downhill effects of these concussions. And, no parent wants their kids to have that. So
No, certainly not. I can certainly understand that, and I understand that you'll be seeing patients up at the Baylor Scott and White Sports Therapy and Research at the Star in Frisco. When
it's so cool up there
in the spring. What sports medicine related services are unique to the Sports Therapy and Research Center?
So, the Star is amazing. It's really a cutting-edge sports performance and healthcare destination focused on athletes and safety and research. I think, as an athlete, it's really a one-stop shop. If you have an initial injury, you're going to get the same MRI imaging quality that the Dallas Cowboys are using. We can see that same day we're going to have a new office and clinic building in that facility. And then your surgery can actually be done 2 floors up in the same building. Post-op for patients, they'll have access to physical therapists on site. There's going to be a great sports performance center to guide them as they return back to their sporting activities. So
that seems pretty cool. Excited to see all that when that opens up in the spring. And we mentioned a little bit. Baylor Scott and White Health is the official sports medicine sponsor of the UIL. We talk with we're a football show. We talk with coaches and we hear all about how they've got kids playing multiple sports, especially track, baseball, basketball. We've got football on the brain, but what I want to get your take maybe on athletes playing multiple sports and maybe how they can take care of themselves as far as that's concerned.
So I think it's kind of a common belief that if you have your child specialize in one sport, you're going to make them a better athlete. And really that has been found to be incorrect. Research has shown that the kids that just focus on one sport, they actually have lower skills than their other colleagues that are playing multiple sports. They have higher injury rates, and they don't develop those normal neuromuscular patterns that are going to protect themselves against injury. They even have looked at some of the Olympic athletes, and 90% of Olympic athletes have said, we're better at this at our sport because we did multiple sports growing up. And a lot of professional athletes, 97% of them said they think that playing multiple sports growing up is what made them so successful. So I just, would encourage parents to have their kids get involved in multiple sports, not to specialize before they hit puberty, and just really let them, spend time being a kid and not have coaches be around all the time.
It's good advice from Dr. Sheena Black on the medical staff of Baylor Scott and White Medical Center in McKinney. And for more information, visit bswhealth.com/ortho. Dr. Black, really appreciate your time.
Yeah, no problem at all. Enjoyed talking to you guys.